Hi, I'm Nelton Tobias, a medical student at KSMU Core, and today I'll be talking about diabetes mellitus. On the introduction, diabetes mellitus is an endocrinological disorder which occurs as a result of lack or reduced insulin efficiency. By insulin efficiency, we mean quantity or sensitivity. So the quantity of insulin might be reduced or not present at all, or there might be a reduced sensitivity or no sensitivity of the cell to insulin at all. So this leads to hyperglycemia, which is increased plasma glucose levels, and leads to vascular pathology, which might be small vessels such as microvasculopathy, or it may affect large vessels such as macrovasculopathy. So when it destroys or damages small vessels, it causes retinopathy, nephropathy, and neuropathy, depending on the part of the body or the part of the vessels, the part of the body or the part of the organ in which those vessels are present. For example, retinopathy, this is a destruction of retinal blood vessels which are found in the retina in the eye. Nephropathy, it is in the nephron or the kidney, and the neuropathy is the neurons, the nerves are also affected. So someone might lose sensations of the skin, and this most of the time it leads to formation of ulcers, like diabetic foot ulcer. So that's one of the complications of diabetes mellitus. Also, the large vessels can be affected. This is called macrovasculopathy. So when the blood vessels which takes blood to your brain, the cerebral blood vessels, when they are affected, it can cause stroke. So the limb blood vessels can cause limb ischemia, uh, and if the coronary arteries, which feeds your heart, they are affected, it leads to heart disease such as myocardial infarction, leads to heart attack. Yes. The types of diabetes mellitus, there are two. There is type 1, type 2 diabetes mellitus. Type 1 was also previously known as insulin-dependent diabetes mellitus because in order for management, in order to treat this kind of patients, the patient needs insulin. Without insulin, uh, no improvement. So in this type of diabetes, usually it starts in adolescents, but it can affect or it can start at any age, and it's caused by deficiency in insulin production, and most of the time it is secondary due to autoimmune destruction of pancreatic beta cell. So there is this gland called the pancreas, which contains two kinds of cells. There is a beta cells and alpha cells. So the beta cells are the one which produce insulin. So when these cells are being destroyed or killed by autoantibodies, there is a lack of secretion of insulin because the cells which are making they are dead, they're not there at all. And our patients, they are prone to weight loss, and it is associated with the other autoimmune diseases. More than 90% they carry a human leukocyte antigen, DR3 or DR4. And the other gene may be affected, the genes which are found in 6q, the chromosome number 6, which determines the isolate sensitivity to damage. And 30% is seen in identical twins, and this indicates that it has weak genetic influence because in type 2 diabetes mellitus, uh, it's like more than 80%, like 80%, it is seen in identical twins. So that has a stronger genetic predisposition than type 1 diabetes mellitus. Okay, going to type 2 diabetes mellitus. This was previously known as non-insulin dependent diabetes mellitus, and usually it has adult onset. Most of the time is 40 years and above, but other literatures say that it starts from 30 years and above, so either 30 or 40. But the key point here is that it starts in adulthood, and it is endemic prevalent. It has an endemic prevalence such as Asian men and elderly, and most of the time it is due to lifestyle changes. We are going to see the risk factors for diabetes mellitus. So lifestyle changes like sedentary lifestyle, not doing exercises, eating too much carbohydrates, eating too much fatty foods, obesity. Those are the kind of lifestyle which prone a person to get diabetes mellitus. And it is caused by reduced insulin secretion or sensitivity. So it leads to insulin resistance. So the cells, they do not respond to insulin at all. And like I've told you from the previous slide, 80% is seen in identical twins, and this indicates stronger genetic influence than type 1 diabetes mellitus. The risk factors in general includes obesity, which means BMI of 30 or above, excess alcohol, excess calories such as carbohydrates, smoking, high intake of saturated fats such as animal fats, lack of exercises, and being Asian, and Cushing disease. The clinical features includes 3 Ps such as polyphagia, which means excessive eating, polydipsia, excessive thirst, and the polyuria, which means excessive urination, and the other generalized body weakness uh, symptom. Diagnosis is by WHO criteria such as fasting blood glucose of more than 7 millimole per liter or more, and the random blood glucose of 11.1 millimole per liter or more, and the oral glucose tolerance test of 11.1 or more millimole per liter. In oral glucose tolerance test, they give a person 75 grams of glucose in 250 or 300 milliliters, and it is measured after 2 hours. Also, there is other investigations such as glycosylated hemoglobin, which should be more than or equal to 48 millimole per liter, plus the symptoms. Management is general, such as the education program, lifestyle advising, such as smoking cessation and alcohol cessation, and regular exercises and diet. In pharmacology also, you can use medication such as insulin in type 1 diabetes, and in type 2 diabetes, you can use medications such as metformin, and metformin increases insulin sensitivity and helps with weight, which the dosage is 500 milligram BD postprandial, and the other medication is gliclazide, and the other one is isofren insulin, which can be also used. Prevention includes regular exercises, reducing intake of saturated fats, restricting alcohol intake, quit smoking, restrict carbohydrate intake, and regular health checkups, and the early initiation of treatment. This is my reference. You can use Oxford Handbook of Clinical Medicine, 9th edition. Thanks for watching my video, and subscribe to my YouTube channel for more videos. Have a nice day.